The Healthcare Labyrinth Podcast is back for another episode. Join Mark S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Mark Ryan, and thanks to everyone for listening in. This week's episode is titled The ACA Exchange Rule, Mark Cuban, and the Beginning of a Healthcare Paradigm Shift. Today, I want to talk about something that frankly may represent one of the biggest shifts in healthcare policy thinking we've seen in years. It comes from two places that at first glance seem completely unrelated. One is the newly finalized 2027 Affordable Care Act exchange rule. The other is entrepreneur Mark Cuban's increasingly vocal criticism of traditional health insurance and his proposal to redirect exchange subsidies towards something called direct primary care. You'll learn a lot about that in this episode. Now, these may seem like separate developments, but they're not. In fact, I think they point to the same conclusion. For years, healthcare policy has focused on one central goal: expanding comprehensive coverage. The assumption has been that if we can get people insured and make benefits richer, we solve the access problem. But what if that's no longer true? What if we've reached the point where coverage on paper is not the same thing as access to care? What if millions of Americans are technically insured, but functionally disconnected from the healthcare system? And what if the future isn't simply richer insurance benefits, but a different way of organizing healthcare altogether? That's what we're discussing today. We will take our regular 3 breaks to split this up a bit, so let's get right into it. So part 1, the growing failure of traditional coverage. Let me start with a confession. For most of my healthcare career, I've been a comprehensive coverage guy. I supported strong benefits, I supported subsidies, I supported efforts to make sure people could access preventative care and primary care. And I still believe those things matter. But over time, I've become increasingly convinced that our current model isn't producing the results we want. That's even with the Affordable Care Act, expanded Medicaid coverage, and things like that. Because healthcare coverage and healthcare access are no longer the same thing. Let's look at what's happening. Healthcare costs continue to rise at staggering rates. Depending on the market, utilization and costs are growing between 6 and 10% annually. The nation's actuaries project roughly 7% annual healthcare spending growth over the next decade. Premiums keep rising. Employers keep shifting workers into leaner plans. They also pass on higher costs to workers. Consumers on the exchanges increasingly select lower cost options with higher deductibles just to stay covered. And despite all the spending, America still has an uninsured rate hovering around 8 to 10%. But here's the issue that gets less attention, what I call the underinsured crisis. Millions of Americans have insurance cards. Millions technically have coverage, yet they cannot realistically afford to use that coverage. They face deductibles that can run several $1,000s per person. They delay care. They skip medications. They avoid seeing physicians. And often they wait until conditions worsen enough to require emergency treatment or inpatient care. Think about that for a moment. We have spent decades debating whether people have insurance. But perhaps the more important question today is whether people can actually use it. Because increasingly, the answer appears to be no. And that's where the 2027 ACA exchange rule enters the picture. With that, we will take our first break, and when we come back, we will jump into the changes in this recently finalized rule. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Mark Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Mark dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Mark is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Mark's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back. My name is Mark Ryan, and I hope you are enjoying this episode of the Healthcare Labyrinth Podcast. We're talking the recently finalized ACA Exchange rule and some paradigm-shifting proposals, along with a recent proposal from entrepreneur Mark Cuban to reform how we think about healthcare and insurance in America. So, part 2, why the 2027 exchange rule matters more than people realize. The 2027 exchange rule generated plenty of controversy. Many Democrats strongly opposed it because it represents a meaningful departure from the traditional ACA philosophy. Of course they'd oppose it. This was their baby. The ACA framework generally emphasized standardized benefits, comprehensive coverage structures, and subsidies designed primarily to lower premium costs. The new rule moves in a different direction, not entirely, but noticeably. At its core, the rule introduces substantially greater flexibility. It expands catastrophic coverage options. It opens the possibility for multi-year plan structures. It removes various requirements for standardized benefit designs. It gives insurers more freedom to create products tailored to different consumer needs. And importantly, it expands opportunities for value-based insurance design. Perhaps most notably, it allows greater flexibility to cover certain preventative and primary care services before deductibles are met, even within high-deductible catastrophic structures. That may all sound very technical, but it reflects something important. Policymakers are increasingly acknowledging that protecting people from catastrophic financial events and providing access to routine primary care may be different problems requiring different solutions. The rule also opens the door to innovative network arrangements and alternative pricing models. In other words, Washington is becoming more willing to experiment. Let me call out 3 threshold changes in the rule that you really need to understand. First, it creates the idea of multi-year catastrophic plans. The idea is to better lock in affordable rates and create a longer-term relationship between insurers and enrollees. Second, at the same time, because catastrophic plans by nature do not offer a lot up front, the federal government is asking plans to come up with evidence-based models to show how upfront coverage for prevention in primary care and chronic disease management could help lower the cost curve and premium rises. If plans can prove this, the upfront coverage they propose could be included in this catastrophic benefit, which otherwise is really a safety net product. Third, it also proposes that non-network products can become qualified health plans in the market if the plan can prove adequate access to providers. In this case, it opens up the opportunity to pair innovative approaches to delivering care up front, perhaps through direct primary care and digital health, along with reference pricing for more costly services like hospitalization and procedures. Under reference pricing, people would be given a set amount for these events and would then have to pay more depending on where they go. They presumably would still have an overall out-of-pocket protections as long as they shop for services. Now, critics argue these changes undermine comprehensive coverage. And they're not entirely wrong, I guess. The rule absolutely challenges the assumption that everyone should be placed into roughly similar insurance designs. But again, here's the uncomfortable reality. The old model isn't solving affordability, as I've noted. Premiums continue rising, deductibles continue rising, consumers continue moving into leaner products, Employers continue scaling back benefits. The market itself is forcing change. The question is whether policymakers adapt to that reality or continue fighting it. What I find most interesting is that the rule implicitly recognizes something healthcare experts have been reluctant to admit. Comprehensive insurance isn't always synonymous with meaningful access. And that realization brings us next to Mark Cuban, because Cuban has been making essentially the same argument, just from a different angle. With that, we will take our second break, and when we come back, we will tell you more about Cuban's direct primary care proposal. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back. My name is Mark Ryan, and I hope you are enjoying this episode of the Healthcare Labyrinth Podcast. We are talking the recently finalized ACA Exchange rule and some paradigm-shifting proposals, along with a recent proposal from entrepreneur Mark Cuban to reform how we think about healthcare and insurance in America. Now on to Cuban's proposal. So, part 3, Mark Cuban's radical proposal. Over the past year, Mark Cuban has increasingly focused on healthcare reform, and one proposal in particular deserves serious attention. His idea is surprisingly simple. Take a portion of ACA Exchange premium subsidies, perhaps around $100 per month, and redirect those dollars into a dedicated account that can only be used for direct primary care or DPC. The rest would be used for a catastrophic coverage plan, and any remaining would be put into a health savings account to help people pay for care outside of the DPC. Now, if you're unfamiliar with direct primary care or DPC, here's the basic concept. Instead of billing insurance for every office visit, patients pay a monthly membership fee to a direct primary care provider. In return, the members receive direct access to their primary care physician. Typically, that includes unlimited visits, same-day or next-day appointments, and certain tests and services that usually are performed in a doctor's office. There's more communication, more care coordination, and dramatically less administrative overhead. Importantly, DPC isn't insurance per se. It's primary care delivered through a subscription model. Under Cuban's concept, insurance remains in place. Catastrophic protection remains in place. But primary care receives dedicated funding separate from the insurance product itself. The remaining subsidy dollars would still help fund insurance premiums or other healthcare expenses. So it's a two-layer system. One layer for primary care, one layer for catastrophic protection. And here's why this matters. Current subsidies primarily help people buy insurance. They don't necessarily help people access care, as I've noted. Someone may have coverage, but still face thousands of dollars in deductible exposure before meaningful benefits kick in. As a result, many people avoid the very services most likely to keep them healthy. Primary care, preventative services, chronic disease management, early intervention. The irony is remarkable. We subsidize insurance, but not necessarily access to it. Cuban's proposal attempts to fix that disconnect. And while it's not a complete solution, it identifies a very real problem. There is actually evidence supporting the concept. Research on direct primary care frequently demonstrates reductions in overall healthcare spending over time. Studies peg this at between 15 and 20% of overall healthcare costs for people in a direct primary care model. Hospitalizations decline, chronic disease management improves, specialist utilization often becomes more appropriate. None of this is magic. It's simply what happens when people can regularly access a physician before problems become crises. Now, there are certain challenges. Regulations would need to change. DPC availability varies by market. Primary care physician shortages exist. Infrastructure would need expansion. Consumer education would be essential. But whether Cuban's exact proposal succeeds is almost beside the point. The important thing is what it reveals, a growing recognition that healthcare financing may need to be fundamentally restructured. And that's where Cuban's ideas intersect directly with the 2027 exchange rule. With that, we'll take our last break, and when we come back, I will give you some concluding thoughts. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Mark Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Mark's insights. Twice a week, Mark publishes a blog to go deep into a current issue. And of course, Mark hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Mark's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back. My name is Mark Ryan, and I hope you are enjoying this episode of the Healthcare Labyrinth Podcast. We're talking the recently finalized ACA Exchange rule and some paradigm-shifting proposals, along with a recent proposal from entrepreneur Mark Cuban to reform how we think about healthcare and insurance in America. So here are my concluding thoughts. So part 4, the paradigm shift. When you step back, the connection becomes obvious. The 2027 exchange rule encourages flexibility, expanded catastrophic options, pre-deductible primary care, alternative benefit structures. Mark Cuban's proposal prioritizes primary care access while reserving insurance for major medical events. I told you at the beginning that I came to this conclusion only after some long deliberation. As I said, I have always been a comprehensive coverage guy, but that I now see that comprehensive coverage in name only does not provide access to care and keep Americans healthy. I do think that we should be generous in terms of coverage and help all Americans afford coverage. But these reforms, as embodied in the exchange rule and through Cuban, are important reforms to make to begin thinking about what comprehensive coverage really means or should be. These proposals represent a healthcare system that is more modular, a system where primary care, catastrophic protection, and consumer-directed spending are distinct components rather than bundled together into a single monolithic insurance product. And I increasingly believe this may be where healthcare is heading and needs to go. Not because policymakers necessarily planned it, but because the economics are forcing it. The sheer cost of premiums created an underinsured crisis. Technology, too, is changing things and how people access care. People now have different views on what coverage is and should be. Even if we successfully tackle healthcare prices through healthcare reform, and we absolutely should, the cost trajectory is unlikely to reverse fast enough to save the existing model. Therefore, we need experimentation and a new direction. At the same time, as I note, technology is changing and consumer expectations are changing. So, in the end, healthcare delivery too is changing. The old insurance paradigm increasingly feels like it belongs to another era. It will remain important, but needs to morph. Now, to be clear, this doesn't mean comprehensive coverage as we know it disappears. Far from it. Many people with complex medical conditions will continue to need robust benefit structures. There will always be a role for comprehensive insurance, but there may also be room for different approaches. Some consumers may prefer lower premiums combined with guaranteed primary care access. Others may choose richer coverage. A flexible marketplace could support both. Of course, critics raise legitimate concerns. Adverse selection, risk segmentation, premium instability, potential rate death spirals. These are real issues. But let's be honest. We're already experiencing many of these pressures today. From a risk and stability standpoint, what we have now is increasingly unsustainable. Costs continue climbing, premiums continue climbing, healthier individuals increasingly move toward leaner coverage, sicker individuals remain concentrated in richer products. The system is already under strain. I think under the new paradigm, the overall risk shouldered by various parts of the healthcare industry, including insurers, can be managed and things remain profitable. Combined with price reform, we might actually get on the right track to lower overall costs and better outcomes. And the emerging model attempts to solve one of the most important failures in healthcare today, access to primary care. And that may be the most important point of all. The healthcare debate has spent decades asking how we expand coverage. The next decade may focus on the different question: how do we ensure people can actually access care? The convergence of the 2027 ACA Exchange rule and Mark Cuban's direct primary care proposal suggests policymakers, innovators, and consumers are beginning to rethink old assumptions. Coverage alone may not be enough. Subsidies alone may not be enough. Comprehensive benefits alone may not be enough. Instead, the future may involve more targeted insurance, stronger primary care access, greater consumer choice, and a more deliberate allocation of healthcare dollars. Whether this transformation ultimately succeeds remains to be seen, but such experiments are long overdue. We may someday look back at the 2027 exchange rule and Cuban's proposal as early indicators of a healthcare paradigm shift that fundamentally changed how Americans think about coverage, access, and care itself. That's it for today's episode of the Healthcare Labyrinth Podcast. Thanks for listening. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Mark Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Mark and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.